I'm here to provide an overview of the Monitoring Senior Services Report for 2024. It's a 10th edition that the Office of the Seniors Advocate has produced, and it's my first. The report details the state of many of services for BC seniors. It includes the 5 areas that our office looks at and monitors: healthcare, housing, income supports, community sports, and transportation. And it provides an overview of several demographic trends for seniors in our province. The report brings information from many sources together in one place, and it allows seniors, service providers, and policymakers to see the larger picture. We compare data year over year, and we go back 5 years to help us see trends over time. The report is around 80 pages in length, and we post all of the 160 plus data tables online for anyone who wants to see them in more detail. The general impressions of British Columbia, there are approximately 5.5 million British Columbians. Of those, almost 1.1 million are over 65. Over 85, there is almost 130,000. So seniors make up 20% of the population. Today, that's 1 in 5. And 2% of the population of British Columbia is over 85. Fast forward 12 years, by 2036, we'll see 1 in 4 British Columbians, or 25% of our province, will be over 65. That's good news. Also, the percentage of seniors with dementia is not increasing. It's remaining steady at 5%. Also good news is a slight decrease in hospitalizations. That's good news. And fewer people waiting in hospital to be discharged to either home with supports or to long-term care. And also, emergency department visits for people over 65 also went down. So that's the good news. Now for the not so good news. Even though the seniors population is increasing, we are not even maintaining service levels year over year. In fact, they're getting worse. So when we look at the days that you're waiting for a long-term care bed in the community, the average is 151 days over the past 5 years. That's a 47% increase. The urgent cases are 73 days. That's a 107% increase over 5 years. And the non-urgent cases are 225 days, an 89% increase. However, from hospital, the average time that you're waiting to move into long-term care is just under 2 months at 59 days, and that's a 74% increase over 5 years. So these are people who are at risk and need long-term care and qualify. Now, having to wait that long to be admitted to long-term care, it's putting further stress on family caregivers who can no longer care for the loved one at home, many of whom are seniors themselves. This shows us that there are people who need long-term care and they're waiting in hospital because they may be admitted faster from the hospital than if they were at home. This is not good news for anyone working in the healthcare system. It's bad for patients, it's bad for patient flow, and it's bad for family caregivers. And the seniors, the demographic trend that we're seeing, the seniors should not be blamed for the trouble we're seeing in hospitals being clogged up. When we look at other services that are available, for example, assisted living, those wait lists are increasing too. There are only in BC 4,300 publicly subsidized assisted living units compared to 28,000 publicly subsidized long-term care beds. Now think about that, 4,300 units, and we have 1,200 people waiting for a publicly subsidized assisted living. That's a 37% increase over 5 years. Therefore, we can't look to assisted living for the solution to relieve the pressure on the hospitals or on long-term care. The number of people waiting in both long-term care and assisted living is growing, and we're simply not building enough new facilities at nearly the same rate as the population is growing. In the 10 years that the Seniors Advocate Office has existed in British Columbia, the problem is getting worse. We continue to report on these statistics. Seniors throughout the province have told me and my office about the difficulties they're facing accessing long-term care, from the long wait times to the lack of beds in their home community. In April, when I toured the province listening to seniors, I met a woman who lives in Cranbrook at a seniors meeting we had, and she told me about how long she had to wait for her husband to get long-term care, and the fact that he ended up moving to Fernie, which is over an hour drive on a highway, a mountain highway away from where she lives, an hour drive for long-term care. Therefore, wait lists and times are too long in long-term care, and the availability in your own community is not there when it should be. Our office will be issuing a report in the new year focusing more on what we can do, what the province can do to address these serious concerns. When we think about other supports that are available, we look to home support because people want to age in place. I hear that all the time from seniors, but they need help to do that. And this help is getting harder to access. Home support provides assistance with daily personal activities. We call these activities of daily living, or ADLs. They're things like bathing, dressing, and medication management. The number of people receiving home support has risen by 11% in the past 5 years. And at the same time, there's a 7% decrease in the client rate per 1,000 people over 75. Let me explain what that means. We know more people are receiving home support through the public system, which is good. However, we are not keeping pace with the population growth because the rate of service provided went down. Unfortunately, the public home support system is not providing enough care. There simply aren't enough hours of home support for people to stay home, which is what seniors and most of us want. A bigger problem that we see as well that's making this even worse is the fact that we charge for home support. For example, if you have an annual income of $30,000, which is slightly below the average income that a senior in British Columbia has, they will end up paying, over the course of 1 year, they'll pay $9,000 for 1 hour of home support. And that becomes nearly 30% of their income. Now, when we think of this, when we take $9,000 away from $30,000, we have $21,000 a year to live on. That's less than $2,000 a month to pay for things like your cost of housing, your food, your transportation, your prescriptions, your medical supplies, and other necessities. The majority of provinces do not charge for home support, including Alberta and Ontario. BC does charge and is one of the most expensive in Canada. Clearly, we need to do something about this. When we look at other services that are available to support people to live at home, there's a program called Better at Home, which is provided by United Way. It's designed to supplement home support by providing assistance with the instrumental activities of daily living, the IADLs. These are things like housekeeping, meal delivery, grocery shopping, visitation, driving to appointments, and other activities. Last year, staff, contractors, and volunteers provided more and more services than ever, showing that the demand is there for these services. Those are definitely increasing. However, the Better at Home demand, the program of Better at Home program, the wait lists have increased by 56% over the past 5 years. And seniors in the rural parts of British Columbia are particularly impacted by this, where this is very difficult to access Better at Home. And I've met with seniors in different communities who reported this and told me personal stories about the challenges of remaining at home safely and not getting enough supports. And it makes a huge difference when it's working, because you can stay home and live longer independently. Another concerning area that we're looking at is surgery wait lists. We're seeing them increasing over the past 5 years, knee replacements by 53% and hip replacements by 59%. While the number of surgeries went up overall, we're not keeping pace with the population growth as wait lists are increasing. Also, abdominal hernia repair and prostate surgery, which are two common surgeries for older people, they're also going up. 19% for abdominal hernia repair and 23% for prostates. However, the wait list for cataract surgery went down by 23%. Having to wait for surgeries impacts the quality of life for seniors, and some find it harder to recover because they're waiting so long, and others are at higher risk of complications the longer they wait. When we think about health, we think about home and housing, and we think housing, we think about health. And when we look to those low-income seniors, they look to affordable housing. It's not available. Senior subsidized housing, we simply don't have enough. There are nearly 14,000 applications last year. That's a 59% increase over 5 years. 6% of applicants did not receive a unit. That means 94% of those 14,000 people did not receive an affordable housing placement. We've seen a 61% increase in the wait list over 5 years and a 17% increase in applicants waiting more than 5 years. At the same time, over those 5 years, we've seen a 3% increase in the units. That's good news. But at the same time, our population growth has outpaced the number of units. So we see a 4.5% decrease in the number of units per 1,000 seniors. In this case, we're calling a senior somebody over 55 over 5 years because they're eligible for this. We're simply not keeping pace with growth and actually falling further behind. Now, the affordable housing is certainly an issue, but when we look to seniors who are at low income, who are in market rental apartments, we're also falling further behind. The Shelter Aid for Elderly Renters, or SAFER program, provides some support. But again, we're seeing some challenges here, where over the past 5 years, a decrease of 8% of SAFER recipients, an 18% decrease in the client rate per 1,000, and the actual subsidy that a senior is receiving. Think about what an average rent would be. That average rent their subsidy is less than $200 on average, and that's a decrease of 7% at $192. Meanwhile, during the same time, the average rent monthly has gone up by 13%. The goal of the SAFER program, according to the Ministry of Housing, is that low-income seniors would pay 30% of their income towards rent, and we're certainly not hitting that target. The government did announce some changes last year, which are encouraging, but unfortunately, those improvements are not tied into the allowable rent increase, meaning the price of the rent, for example, this year would go up by 3.5%, but the SAFER benefit wouldn't go up the same corresponding amount, nor does it go up to inflation. Therefore, as rents go up, there are no corresponding SAFER benefit increases. And in addition to that, when a senior's federal pension income goes up because it's tied to inflation, the SAFER subsidy is clawed back, leaving seniors no further ahead. Essentially, seniors receiving SAFER are losing ground every year. Changing gears and moving to transportation, there is good news that 88% of seniors in the cohort of 65 to 74 have a driver's license and are continuing to drive. That's a 10% increase over 5 years. Now, at 75 years of age, seniors begin to relinquish their license for many different reasons. And those people who do not drive anymore are relying on public transportation. There is some good news here that last year, 65,000 seniors had a BC bus pass. That's an increase of 17% over the previous year. And that's a change in the trend that we have seen a decline since 2019. But those seniors who need extra assistance in getting around rely on HandyDart. And unfortunately, we're not keeping up with demand. Where in the past 5 years, we've seen unfulfilled HandyDart requests being increased by 44%. Meanwhile, over the past 5 years, we've seen a decrease of 15% of HandyDart rides. If you think about how important the transportation is to combat isolation, loneliness, and social exclusion, we need a transportation system that works for seniors, especially those seniors who rely on things like HandyDart for their daily living to get to appointments, This is even more critical in rural British Columbia, where they find it very difficult. Handy Dart and transportation generally is a lifeline for seniors who need to get around and maintain some level of independence. The last area I want to focus on is public safety. This is another troubling area where over the past 5 years, we've seen an increase of 18% of seniors being victims of violent offenses reported to the RCMP. Also, an increase of 23% of victims of assault reported to the RCMP, as well as fraud has increased by 88% reported to the RCMP. The dramatic instances of abuse against seniors is particularly concerning because incidents often go unreported. The victim may feel embarrassed or feels retaliation or is unwilling and to report a family member or other loved one because they're worried they'll get in trouble. Anyone who suspects a senior may be being abused can call the police, the health authorities, Crime Stoppers, Seniors Abuse and Information Line, BC 211, and of course they can call our office of the Seniors Advocate. I want to reemphasize a recommendation I made in the June report, Aging Matters, that we're calling on the government to have a cross-ministerial seniors plan that's action-oriented and with measurable outcomes. Senior services are offered by many different ministries, and we want to see them all working together, especially the 4 key ones: the Ministry of Transportation and Transit, the Ministry of Social Development and Poverty Reduction, and the Ministry of Housing and Municipal Affairs, as well as the Ministry of Health. This plan must outline what the government's priorities are for the growing needs of the seniors in our province. It's clear from this monitoring report that from the data that we're seeing that we're not maintaining the same level of services for seniors. We're actually going backward. Seniors and their families must feel that there's health care when they need it, that the long-term care placement is available without waiting too long close to where they live, that housing and social supports are there when they need them, and that they're close to home so they can stay in their community near their family and friends. That concludes the areas of this year's report I wanted to highlight today. Again, I'd encourage anyone who wants to know more about any of these topics to read the report and the data tables, which can be found at the seniorsAdvocatebc.ca website. While the report was developed with lead coming from the Office of the Seniors Advocate, others were involved, including the health authorities, ministries, service providers, and others had key roles in providing information for the report. I want to thank all of them sincerely for the work and the huge dedication that went in to getting this one-of-a-kind report developed. It was we're very, very grateful for all your work. So thank you very much, and I'd be happy to answer any questions now.
A reminder to reporters on the line, please press *1 to enter the queue. You'll be limited to 1 question and 1 follow-up. We'll start in the room. If you could please say your name and your media outlet. Thank you.
Richard Zussman, Global BC. Dan, to the last point you were making about a cross-ministry approach, is this an acknowledgement that the government has not done enough to prepare for the silver tsunami in a concerted effort?
Well, when we think about the demographic trend, the apocalyptic demography, often the term silver tsunami is used, and I would suggest silver is good, but tsunami suggests we haven't known about it, and it's violent. The demographic trend we've known about for years, and I would call it more of a rising tide. And the silver tsunami, the tsunami suggests that it's violence. I don't think seniors are violent. So I call it a rising tide. We've known about this for a long time. Have we done enough? Clearly from the data we've shown today and reported on, we're not keeping up with the pace that we need to invest in things like long-term care, assisted living, more affordable housing, the SAFER program, Handy Dart and transportation. Those services we need more of, and certainly you look at acute care, we need to do a lot more to reduce those wait lists. So yes, we need a plan that's comprehensive, that demonstrates that seniors' lives matter in British Columbia.
I know British Columbians live in British Columbia, but I'm sure if you look across other jurisdictions, they're having similar challenges when it comes to long-term care spaces, when it comes to knees and hips.
About access to hospital care, especially things that keep seniors independent longer. Hips and knees is certainly 2 of them. We'd love to see those surgeries, more of them available, and the wait list going down. So we've got to invest a lot more in our acute care system, specifically the geriatric access to hospitals has to improve, and we've got to see much more investment in our community so seniors can age in place.
Hi, it's Dirk Meisner from Canadian Press. When you say home care, we need to do something about home care support, are you saying don't charge for it?
Yes, we're saying don't charge for it. When we think about the other provinces that offer home support, the majority of provinces in Canada do not charge a senior for home support. That includes Alberta and Ontario. BC does and charges quite a bit. So if you're making $9,000 a year, if that's what you're living on, you're going to spend $9,000 a year for 1 hour of home support. Now you're left over with $21,000 to live on, and that's less than $2,000 a month. And you got to then use that money to pay for all your living expenses. And seniors are now making trade-offs. They're thinking about, do I even have that home support because it's unaffordable? And then if I do have it, what am I gonna give up? So you're making tough choices. And actually there's cases where seniors are choosing to move into assisted living and long-term care prematurely because of that situation where it's less expensive to live there than to stay at home.
Okay, a follow-up question. Of all the numbers, the data you're showing that the numbers of seniors are increasing the population in British Columbia, what's the thing we should be dealing with the most to address that growing numbers of population?
Well, first of all, I think we should have a perception and a viewpoint that the aging demographic is good news. Longevity is good news. Aging is good. What we want to see is the investment in the things that make the biggest difference. And some of those numbers are staggering, in particular around long-term care, the waiting time for long-term care, in particular waiting in the community. When the program was introduced, the long-term care program in 1978, it was celebrated for the fact that you could enter the system through the primary care system. Now we know doctors are challenged to find one. How many seniors are attached is a concern. And then if you are attached to primary care, how are you getting into the system? You should be able to get in the system in a planned way, waiting at home, not having to go to the hospital to move in. I think that's our number one thing that concerns me, and that's why we'll be issuing a report in the new year about long-term care demand and supply.
Mark Page from BC Today here. So, you know, I read in your report that, you know, one of the concerns with senior services is that, you know, they're uncoordinated and somewhat confusing in how they're provided, you know, from different ministries. And, you know, when you're advocating for a cross-ministerial approach, wouldn't it be better, or would you advocate to have a Ministry of Senior Services to coordinate all of those things in one place?
Well, there is a Secretary of State a Parliamentary Secretary of State for seniors and long-term care. That's a good position to have within the Ministry of Health. When we think about seniors, do we need a ministry? I leave that to the government to decide. From my point of view, the key thing is that we have a plan that is coordinated through the different ministries, the different services, but even coordinated within the ministries is important. Currently, if you live, for example, in assisted living, and you're on a campus of care where there's a long-term care home on the same property, you aren't guaranteed to move into that home because we have a wait list that is based on equity where everyone has a chance for that same bed. So we're having challenges within one ministry, but we also want to see that same coordination. So for example, if you're living in rural BC where you have to get transportation to a hospital appointment, we want to see that same transportation waits for you and is coordinated so you can get all the services you need that day going into that center for acute care and then come back home. So there are things we can do where we're also looking at housing, making sure housing's properly positioned near where healthcare is.
And, you know, you mentioned a lot of actions here. You know, in terms of like if you could have your number one sort of short-term action to help right now, what would your ask be?
Well, my number one ask right now of government is the seniors plan. We want to see that whether it's housing, whether it's healthcare, whether it's transportation, whether it's the income supports, we want to see all those things wrapped up together so that seniors from their point of view they're connected and they have navigation right through the system from the moment they need their first services until the end of life, including bereavement support for their loved ones. We want to see that cross-ministerial approach because we're seeing the fragmentation and we're seeing the challenges. For example, if you live in housing, affordable housing, if you're lucky enough to get into that, you should have social supports. There are some great programs out there, but they're disconnected. The healthcare system is providing that support where perhaps it could be built in within the housing support so people could age in place where they are.
Next, we'll go to the phones. We have Mary Brooke from Island Social Trends.
Hi, just wondering about SAFER. The changes that the minister made in June through the housing ministry have not really been implemented very well. People are still falling short and in fact getting less money now because of that rent ceiling aspect and also the income threshold. Just wondering if you have met with the appropriate ministry representatives for that, and also if it's been made clear that an income can go up either by earnings or government support, which are obviously two different life situations.
Yeah, thank you for the question. I certainly have had a conversation with the minister, and we'll have conversations in the new year also on the SAFER program. Our office will continue to advocate and raise the issue around the SAFER program being inadequate, not meeting the needs of seniors for that support. If it was working the way it should be, where you have 30% of a senior's income paying for rent, no more, then we know that the program's working, but we're not hitting that target. So we know the rent ceiling has to be increased. We know the income threshold is a factor there, and also the subsidy. And all three of those have to work together. When you mentioned the point about the different levels of income, so as I mentioned in the report, if you are receiving a subsidy or an income from the government and that increases, then the SAFER program claws it back, which doesn't make sense because now the senior is no further ahead. So there are definitely improvements that have to be made to SAFER, and we'll be continuing to recommend that those changes are made.
Did you have a follow-up, Mary?
Yes, thanks. So with your cross-ministry approach, which you've talked about pretty much all year, now there is that new parliamentary secretary for senior services. Will you be meeting with her first to kind of flesh out what might be in your cross-ministry plan?
Yes, I will be meeting with her in the new year. I did have interactions with her previously in her previous roles, and I have had a chance already to talk to the health minister about the cross-ministerial strategy, and we'll be encouraging and working with government to do our best to make sure that happens, because we want to see that comprehensive plan for seniors. We want to see that there's measurable targets and the outcomes are met. I think the seniors in British Columbia, 1.1 million seniors who are here, deserve to have a plan, and I think it's really important that all 5.5 million British Columbians care deeply about seniors. If we are lucky enough to live long enough, we will become a senior ourselves. So we need to have a seniors plan to provide a better future for all of us.
Next, we'll go to Cindy Harnett from the Victoria Times Colonist.
Hi, thanks so much. You've already addressed the wait for the average wait times for long-term care, but can you give additional comment, please? It seems that Island Health has the highest for non-urgent, the highest for urgent, as well as the highest waits from hospital to long-term care. Can you explain that or give any messaging to Island Health particularly?
Cindy, thank you for the question. When we look at Vancouver Island, we know that certainly in certain pockets of the island, we have a much higher proportion of seniors living in that area than just about anywhere else in the province. That includes Greater Victoria and certainly Mid-Island. And when you think about the availability of long-term care for that population, it's not there. The supports simply haven't kept up with the demand and the proportion of seniors who are there. And we're also seeing that in acute care. And the data is definitely skewed. And there's going to be one health authority that stands out in this report and those measures. It's Island Health, and certainly more investment has to be made on the island disproportionately compared to other parts of the province in order to keep up with demand.
Did you have a follow-up?
Yeah, maybe if you could just comment on we didn't really hear a lot about seniors in the election. It's not the top issue, and yet we see the urgency that's in this report that if we don't act fast. Do you have any thoughts on why we're not acting with the urgency that we need to broach these problems that they're seemingly going to get worse?
Well, one of the things I would encourage everyone to do in BC by Friday is to complete our survey on ageism. We have a survey that we put out a few weeks ago. It closes this Friday. And we're encouraging British Columbians to fill out the survey around age discrimination and ageism. We want to know if people have experienced it, but also if they're a concern for it. When we think about how we prioritize populations, it's really important that we rethink what aging looks like in our province, and that we embrace growing old. I think if we embrace growing old and embrace services for seniors, we'll see that more investment is made in that population, that a 90-year-old is as important as a 9-year-old, as important as a 49-year-old, that everyone is getting the kinds of resources and supports they need. And certainly seniors, for a number of different reasons, need more supports often than other groups of people do. So we want to see that investment made, and we're encouraging everyone in British Columbia to complete the survey by Friday.
Thank you. That concludes today's event.